Hey, welcome back to the Invigorate podcast, where we discuss the realities of living with autoimmune diseases, but more importantly, tips, tools, and resources to help us navigate these challenging journeys.
That's right. And our special guest today is none other than Meredith LiCalzi, a medical student at Quinnipiac University. What's going on, Meredith?
I'm good. Thanks for having me.
Thanks for being here. Meredith is conducting research through Yale on medication adherence to a common medication used to treat various autoimmune diseases, including Sjogren's and lupus.
Yes.
Meredith is an extra special guest because we know her through the You Got This Kid Leadership Foundation. So that foundation I'm a co-founder of and board member of, and Chris has helped us with our volunteer work. We provide leadership development training, but then also financially support students who are going into environmental sustainabilities or the medical field, as in Meredith's case. So we're very excited to talk to Meredith today and her work that she's doing at Yale. But before that, do you want to give your background and your experience and how you got into medical school?
Sure. Okay, well, right now I'm a second year student, so let me go back to when I didn't think I wanted to be a doctor growing up. It was not I thought maybe healthcare, but there was really no one in my family who did that. Everyone did sales and teaching and business stuff. So
Gotcha.
I went into college studying business undergrad, and it was okay. I was at an engineering school, so it was the easier route to go. And
I wouldn't call that easy, but okay.
Right. But I ended up doing an internship at a startup company, and I liked it, but I just felt like there was something missing.
Mm-hmm.
Looking at Excel spreadsheets all day was not giving me that, I don't know, sense of fulfillment I was looking for.
Sure.
And around the same time, I'd been dealing with some new health issues that started when I was 18 or 19.
Mm-hmm.
And I had been going to doctors all the time and they couldn't figure out what was going on with me. And then I just grew more frustrated with my own health experiences and healthcare in general. And I think that's when I started thinking about going into medicine. So halfway through college, I completely changed my major to biology, and my whole life course I changed. I ended up working as a medical assistant at an OBGYN office after I graduated while I was applying, and then ended up at Quinnipiac, which was just don't tell them. I'd never heard of this school. I'm from Atlanta. I was okay, I'll come here to where I got in, and I've just been having a good experience up here, so I feel like it was all meant to be.
That's it. Meredith, we've done the opposite track. I grew up in the Northeast and went to school down south. You grew up in the South and went to school in the Northeast.
Yeah, what do you prefer?
You know what? At the time when I was in high school making that decision, I said, "Get me away from the cold." So I was I don't want to ever see snow again. So it's been nice to be in the South for a lot of reasons, but Northeast is just so it's hard to be bored.
Yeah.
In that area, in particular.
Everything's so close together, and then
right.
But I do miss I just don't like the long winters up here.
Understandable.
Yeah.
That's really it. So when you think about it in terms of that sense of fulfillment that you mentioned, and that sense of saying okay, I now feel sort of inspired to do it. What exactly is it about the medical profession that really gets you going and makes you feel I'm coming alive by doing this?
I think connecting with people and really just listening to their story. For me, I felt my experience seeing doctors rushed with autoimmune problems, it's not everything is connected. It's disjointed symptoms sometimes, and
Right.
you need someone to listen to the full story to appreciate what might be going on. For me, being able to give that to my future patients and the patients I currently see at my clinical sites, listening, laying the foundation for trust and support, fulfills me about medicine. and making people feel better, like actually like
Right.
resolving their symptoms.
That's really it. That's really
Yeah.
it. That sense of like being a part of the healing journey with people.
Yeah.
That's awesome. That's really awesome.
Chris and I have talked about before, having to navigate autoimmune diseases. It's hard and challenging, and going through it, you develop just a greater sense of empathy for others, even if it's not one-to-one autoimmune disease related, just anyone having a hard time or kind of going through challenging times. It's you just can empathize more with them. And so I think it's really noble and credible of you to go into the medical field and bring that sense of warmth to patients, because man, there are some tough times and you really want to feel like you're being heard.
Mm-hmm.
Yeah. Oh, thank you.
Hear more about the research work that you're doing at Yale and the specific project you're working on. So can you tell us about that?
So when I was looking at, we do a capstone project for medical school, like at my program, and it's supposed to span like most of your time at school. So like you look for like, you know, a longitudinal project to do. And I like knew I wanted to do something related to autoimmune diseases. So I have Sjogren's. Like, it's a common autoimmune disease, but it's like actually kind of difficult to find research projects going on with it. And like lupus is one of the most, I feel like, prominent autoimmune diseases with like a lot of robust research going on. So I was like less concerned about like what I was doing it on, because in my mind, like so many of the autoimmune diseases are just like a family of diseases to me. Like doing research for one just like helps all the other ones. So
Right.
I really just wanted to find someone like a mentor who was, you know, like doing a lot of work in research for autoimmune diseases in general. And I ended up finding a rheumatologist at Yale. His name's Dr. Kamporas, and he's like just like a superstar in especially the field of lupus. But like, he's just like started clinics and programs, and he's like involved in teaching and directing programs. So he's like kind of a big deal. And I just like shot him an email, and he ended up like agreeing to meet with me. And I talked to him like originally my passion, and I plan to do this at some point. My goal is to like work on a project where I can, you know, improve the diagnostics, like shorten the time it takes to get diagnosed, because like that's like a big part of the struggle with autoimmune diseases. But what he like had suggested and was kind of like in the works a little bit already was a project to improve adherence to hydroxychloroquine, which is like the first line treatment for lupus, Sjogren's, like I think rheumatoid arthritis, and like a couple other autoimmune diseases. And I was like, okay, like anything that can help, especially like I was drawn to the fact that it was community based. Like we would be, you know, trying to improve it among patients that he sees and like that are seen in the Yale New Haven health system, where like I'm living now, seemed like meaningful to me. And you know, it's a drug that I take that has improved a lot of my symptoms. So I wanted to like improve adherence so that other people can also experience that same benefit. And just understand, like, not just like improve adherence, but understand why people aren't taking it, and like what is like, because like, I don't know, everything is so nuanced and layered when it comes to like behavior around medication, especially with like chronic diseases, that I just wanted to like understand that better for like my own benefit and when I'm treating patients in the future, but also like if we can find a way to improve it and apply it to like people all over, that would be pretty cool too.
Taking medication regularly among all chronic illnesses it's widespread as far as how consistent people are.
Right.
And I know with myself, I'm actually guilty of it as we speak because one of my medications I take on a weekly basis, and I had to get my doctor's approval to refill it. So there was a couple day delay there, and then I had to wait for the pharmacy. So there's a couple day delay there, and I'll get there today, but it's like I'm already about 5 days behind, and it's like, that it gets tricky then, So
Yeah,
there you have it.
sometimes it's like just as simple as logistics. It's like you want to take it and you can't.
Right.
I know with my pharmacy, I can only refill like 1 month at a time. So
Mhm.
if I travel, like I have to like put in those requests in advance and stuff. I can't just get like a 3 month supply.
Mhm.
It's just like frustrating.
Absolutely. Now, I think what you're describing, even Karen's on-air confession just now, I think it's I think it's honestly something that we've all been through, and just there are things like that just pop up and kind of make the process so delayed or so much more complicated than it needs to be. But just also thinking about the ways in which I try to like pay attention to the way my body responds, especially as my doctors are introducing new medicines. And it feels to me like all of the medicines really do work in concert. Like you do have this kind of like pill shaped Jenga piece where like you take one pill out, it just starts to like wobble a little bit. You can kind of feel like, oh man, I really do need to call the doctor, make sure that refill is put in because I'm feeling the difference.
I think like it's hard when you take multiple medications for a chronic disease and you start to like I'm the type of person like I want to like isolate everything and like have a reason like okay, when I take this is like the symptoms I feel like the change in symptoms or like the side
Right.
effects. And then when you're like taking multiple things at the same time, you're like, is this my disease? Is this the medication? Like
Come
what's
on.
going
Yeah.
on? Like
Totally. Because I mean, you bring up a great point, Meredith. There's so many of the medicines, especially when we're just getting introduced to them, that can feel, frankly, worse than the disease itself. It can really be a doozy, and I think for those of us in this community who we're not as quick to want to like follow those orders and say, okay, we're gonna power through that tough time and keep taking the medicine. I think it can get tough for folks who are just, saying like, oh no, this is making me feel worse, and not necessarily having that long-term view of overall health maintenance.
like if you don't know exactly what the drug does, like why you're taking it, and like, or if you don't have that strong like foundation of trust with your provider,
Come on,
like
right?
just like and like I don't know, like I feel like having an autoimmune disease, I'm always like a little skeptical because it took so long to get diagnosed and I got so many like wrong opinions in the beginning, but I'm
Right, right.
like more suspicious.
Yeah, yeah.
And I'm like, I have like had to rely on my own, I don't know, like intuition and
Sure.
feeling so much that like I just like I feel like I've become sometimes like this experimenter in my own with my own body. I'm like,
Come on.
I'll take away this drug for a week and see how I feel, and then I'll reintroduce it. Like, it's like I feel like there's no rules. You're just like doing it on your own.
That's
Like,
it.
I
That's
should be
it.
supervised.
Right, right. Somebody needs to come check in on me. That's real.
Well, definitely like a giant jigsaw puzzle. And when we're on multiple medications and then you add supplements into that, and even sometimes when you don't feel well, but the other end of the spectrum is, hey, I've been in remission. I've been doing really well. Do I really need all
Need 'em.
this medication?
Right, right.
Yeah.
The temptation's always there to feel like it's over, like we're done. Like, and Karin, I think what you're saying is a perfect example, because I remember I had a friend who also had lupus. We worked at the same school at one point, and he was like, yeah, I found this. It was, I forget what it was, some sort of like nutritional supplement that he was like, this is way better than the medicine I'm taking. I'm just gonna stick with this. And I was like, man, I know this stuff that we're taking doesn't always feel great, but I know a lot of people who've done research and have read about this, and there's like there were boards that had to approve it before they could sell it to me. you just got that from the grocery store. I don't know if that's gonna be the same thing. So that temptation to be like, I'm feeling better, doesn't, but and assuming that feeling better means doing better. That's a landmine we gotta avoid.
Yeah.
On the flip side, I still feel crappy. Is this even working?
That's true too.
So you have like issues on both sides.
Certainly.
That distrust or kind of not having a lot of faith in the system. I've been there on the opposite, kind of where I received so much medication that the side effects of the steroids that I was on actually resulted in avascular necrosis, which is a degenerative bone disease.
Right.
And so that I had multiple surgeries and 6 joints. So, and I even was at the orthopedic urgent care yesterday for one of my knees, and they wanted to put me on steroids to help. And I was just like, no, I'm good. I'll ride out the pain. So it's like, I'm almost scared that they're doing too much now. So I'm like, do I really need to take all this? So going back to just building that trust with your rheumatologist or providers is just invaluable.
And everything is like a risk benefit analysis too. And like medicine in general, it's like the steroids will help with the inflammation, but at what cost? The year I was applying to medical school, the most stressful year
imaginable.
And about where I was going to be, like if I was going to get in. And I was just having like a bunch of flares. My flares present like typically with like, I get like fatigue and like difficulty concentrating.
Sure.
But then I also get like blistered toes that are extremely painful and make it difficult to walk. I know it's horrible. And
it is what it is.
Yeah.
Like my deformed feet. And I remember like calling my rheumatologist's office like pretty frequently asking for steroids because it was the only thing that would make the inflammation go down. And like after like a couple times, like I remember feeling like they were like, no, they denied me. And I was like, oh, they think I'm like drug seeking.
Oh no.
They think I like want more medication than like I should be getting right now. And like I felt like, I don't know, I was like, they just don't get it. But I kind of see now in medical school, like the other side of things, like you don't want to like give your patients so much medication that it ends up hurting them in a different way.
Right.
But yeah, just like interesting experiences.
Yeah. But you know, as you say that, Meredith, I think about just the sort of like perfect storm of a lowering trust and specialization just in society in general, shorter time between patient and doctors, and also just that growing sense of like, well, yeah, I get that you went to school for this, but I also saw this on YouTube. Like I feel like all of that is in the mix. So like, you know, in your work already, like, you know, with med school, you've had some interaction with patients. Like, how do you feel doctors and those who are medical providers can really sort of like get over that hump of really building that trust with the patient and you know, getting through to them in a way that is frankly louder than the YouTube video or whatever they're using to sort of inform themselves?
I mean, that's a great question. I think like I wish I had all the answers. I don't.
Right.
You know, the time constraints is like not ideal. I think that like the best thing you can do is like the first time you see a patient or like, really the first time, just say like, tell me your story from the beginning and give people that opportunity to like walk you through it so that they feel like you have the whole story. And then like that alone will build so much more trust. Like sometimes doctors walk into the room and they're like, oh, I know everything about this disease, like, but you don't know their story.
Right.
And like, if you know, I don't know what someone's experiences are, you're like, you can like treat them. You can come up with a better treatment plan that works for them.
You're meeting with your patients. It sounds you really are actively listening to them. the challenges of the duration of the appointments, but you even just like facing them, being engaged. I've had providers just staring at the computer screen the whole time. Can you just stop and look at me for a second? And it's like, even if I only have 2 minutes to talk, if you're looking at me, I feel more heard than if you're busy doing whatever you need to do.
Right.
And I think like a lot of people too, I remember talking to my grandma, and my grandma also, she has rheumatoid arthritis. So sometimes we like talk about our autoimmune problems together. And she has thyroid issues. And she was like, I went to the doctor the other day and they didn't even touch me. They like were on their computer, and I said, don't you need to like examine me? Like,
right.
give a physical exam. So like I think that things have just changed so much recently with like technology. People are like, providers are on their computers. We've lost connection that we used to have, the patient doctor connection. That like it's just missing, but it can come back, and you just have to find, like, sometimes it's hard to find the right doctor, and like especially with rheumatology, I feel like there's so few rheumatologists that you have to wait like an exorbitant amount of time to see a provider that you're oh, this is really my like one shot. Like you feel a lot of pressure. I think like from the patient side is like, because you know that you're only going to get so much time, like come prepared. I would like write a list down of what you want to talk about, because like it's so overwhelming in there. Sometimes you can just like completely forget to mention something that was really bothering you.
Now I love that you mentioned that, because I feel like when I was new in my lupus journey, I would spend those rheumatologist appointments talking to them like they were my friend. Like I'd be like, so first this happened, and then the person wasn't very nice, and I didn't really like that, and like tell them about like my day basically. And I was like, I just learned like, yo man, we gotta wrap this up. Like just come in here with the facts, just the facts. And so to your point, Meredith, it's really important to have a really strong working narrative, but also conversely making sure that the doctor is putting forth that effort to just show the human touch. You know, something I've said. So you may have been in the room when I said this over the summer, is to just remember that, you know, for the doctor, this could be, you know, their 4 o'clock could be their like last appointment of the day. They've had like 6 people they've seen that day, or however many people they've seen. But for that patient, particularly thinking about how hard it is to get an appointment, especially if you're a new patient, God bless, you know, you could be, we're recording this in October, you could get your first appointment in February or something like that, you know,
right.
Like it can be like that. So just thinking about what it means to just be fully present with the person, and regardless of how many patients you've seen that day, just giving them that sense of, wow, this patient, for them, this is the most important appointment they have today. So just really honoring that space, you know?
Yeah, that's such a good point.
One thing I've learned from my experience is making sure you're also explaining what you're looking to get out of it. I had a fantastic first rheumatologist who was just more laid back and took a more cautious approach. But at the time, I was eager to get my life back. So I was like, ooh, I don't want to wait 4 months to see if this works. Like, let's get this show on the road. But then on the flip side, my rheumatologist now, who I absolutely love too, and he is fantastic, he does have a more aggressive approach. But now I'm the opposite, and I'm like, ooh, maybe we don't need all this.
Come on.
But just talking with both of them about how I want to live my life, how active I am. I need to be able to keep up with my 2 boys. I'm more open to medication so I can live that kind of high quality active life for me personally.
And that's how I think medicine, at least the way we're being taught in schools, is shifting to be more like a joint decision between the physician and the patient, not just like this like old paternalistic approach of like, I'm the doctor, this is what I'm giving you, like follow my orders.
Right.
Like it's more like, here are like the options, like what works with you.
I hear that.
Like,
yeah, because it has to be a good partnership.
Yeah.
You know, because as much as the doctor does have the knowledge, and we need to respect that knowledge, there is something particularly with the autoimmune community where we know that these diseases show up. They feel so customized. It's almost like snowflakes. Like no two are the same. So you have to sort of listen to the way in which it's manifesting in that person's body and in their experience. Like I know for and you talked about your experience with Sjogren's, but for lupus, it can take some people years to get a proper diagnosis. There's so many times people get turned away and just say, "Oh, it's not that." Like you're just you're stressed. Like I can't tell you how many times I've been like tested for diabetes. And I was like, test me again. I promise you, I won't have diabetes this time. Like it's just so many different ways in which people are using their like knowledge, but not necessarily honoring the experience of the patient too.
Thinking back to like all the visits I had before I got diagnosed, and it was like, just like, I felt like so dismissed by doctors. Like, oh, maybe you're wearing your shoes too tight, and I'm like, shoes I've been wearing, like,
giving you fashion
my
sense.
whole life. They were like, it might be a fungal infection, like herpes. It could be an allergic reaction. I was doing crazy stuff. They told me to put diaper rash ointment on my lips. Like I had like lip rash, and I was like, really? Like and now it like blows my mind because, and like I also have my slant from my own personal experience, but like
right.
I always jump to autoimmune. I'm like, oh, that could be autoimmune, but like it's because it's like autoimmune presents in like so many different ways.
So many ways.
That's where my mind always goes now, especially like with women. I know like, and like this is like a completely separate topic, but like women so often are like their issues are belittled or dismissed in healthcare, and like because 9 out of 10 pretty much for lupus and Sjogren's, 9 out of 10 people who have it are women.
Right.
Like I feel like you just like can't deny that overlap. Extra dismissal of those patients.
Oh, no question. It's not just correlation, it's causation.
Yeah.
You know what I mean? Absolutely.
Meredith, how is your Sjogren's now? Is it being managed with the hydroxychloroquine?
I have like good days and bad days.
Sure.
Like I've like picked a pretty stressful career path in life, but it's like managed with medication, and I like recently started another one that's like helped my toes a lot.
Great.
I think like the biggest challenge I face is with my fatigue, and that's just like been difficult to manage school and like all the extracurriculars. But I also like just ran my first ever half marathon over the weekend, so like I'm like doing stuff that I had never done even before I was sick.
Right.
So like I feel like it's just like I'm not at baseline of what I was before, but I think I'm just like more gentle with myself, and like I can be like hard on myself, and I'm like, would I say the same thing to a friend who is going through this? Like, no. Being nice to myself about it helps me manage it more easily. I don't know if you guys have had like similar experiences, but it's like it's chronic, it's like there's highs and lows and like good days and bad days, and it's just like accepting it but still having hope for the future, I think is like been really important.
Yeah, absolutely. I love that you talk about it in terms of being kind to yourself, because I think we, especially at the beginning of the journey, are so overwhelmed by just like the fatigue, especially if you're like a high achieving person. Is such a frustrating thing, and frankly feels like a betrayal from your body to you. But what other things do you do to make sure you're taking care of yourself? Like thinking about like the social activities, you talk about the physical, so I'm guessing you're a runner. God bless you. My friend tried to get me to run a marathon next year. I get bored on the treadmill, so I don't know how that's gonna go. But just thinking about the ways in which you're taking care of yourself. How are you doing?
Yeah, like exercise is important to me. I think like I'm like driven when it comes to my career and school and stuff, but like pretty laid back socially. So I think that like just spending time with my friends and my husband and my dog, who's like doing something in the other room,
Good stuff,
is like always like helps me. And like I also like found a lot of comfort with talking to my other friends who have autoimmune diseases. I think like has been really therapeutic.
Right.
I don't know. I just got a juicer. I'm making a lot of juices now.
Okay.
Like make me feel better. But I'm still navigating it. I mean, like it's been like since my formal diagnosis, like 3 years. So still figuring it out.
That's it.
It's very much a multifaceted approach where you have to take your medicine, you have to eat as clean as you can, exercise, get your rest. So it's really just a holistic approach to managing these diseases, and taking your medication is just one piece of it.
Yeah. Definitely getting sleep. I like
Oof.
go to bed at 9:30.
Listen, you have to. You know, are you a morning person?
No.
No. That's all right. But getting your rest is important for sure.
It's tough when you're fighting fatigue. You need
That's
a lot
true.
of hours of rest.
Yeah, that is like been the hardest part for me, definitely.
Got you.
But my husband like wakes up at 5 a.m. to go to the gym. So like he's okay to go to bed at 9:30 too, and like he just like gets like 7 hours of sleep and like is fine, and I'm like waking up when he's coming home from the gym, and I'm like with my full 8.5, 9 hours of sleep.
Come on.
Like, I could use a little more.
Right.
You got to do what you got to do, though. My kids started going to bed at 8:30. It's like I crawl in and I'm asleep by 9. I mean, on good days I can get up by 5:30, but normally it might be a little later than that.
Yeah. No shame.
Find a lot of like peace in having routine and structure.
No doubt.
My hardest year was the one when I was applying to med school, because it was like there's so much uncertainty, and like my schedule was changing a lot. Even though med school is stressful in its own way with learning all this new stuff, like just to be able to establish a routine for myself definitely like has helped.
Yeah. Because we need stability, right?
Yeah. And a good support system. Like, that's been huge.
Definitely.
It helps to stay organized and structured. So then you can stay on top of that and really make sure that, again, you're carving out that time so you can get 8 or 9 hours of sleep if you need it.
Yeah. Prioritizing. Like, I used to put off like things just so I could finish for a deadline. I don't do that as much anymore. There will always be tomorrow. I need to focus on my health. Like, I just value it more because it's like more fragile, and I'll do anything to like keep it stable.
Sure. That's true.
But yeah, we'll see. We'll see how the like overnight shifts go in my rotations. The lifestyle is really going to be important for me to like manage being a doctor and like having an autoimmune disease. But it'll be interesting to see with my rotations, because I'm sure there's things like that I really like, but like might not have, like I might not be able to get the sleep I need.
Right, that's real too.
So just
So
another like thing to consider. But everybody also, like autoimmune disease or not, has like those factors in their life that they need to like consider.
Exactly, just part of the human condition.
Yeah.
With you, I was wondering, when you talked about the sort of like structure and stability, it made me think a lot about like people's consistency in general. So when it comes to, we were talking earlier about like medication, and we all confess that sometimes we kind of mess up with our doses and taking them on time, getting the refills ready. What kind of tips would you suggest in terms of like how to promote just an overall sense of consistency, whether it's with the medication or with getting sleep, or just taking care of yourself, knowing to say this can wait till tomorrow? Like, what are the things that have helped you that you think would be helpful for our audience?
I think like reminding myself why I take the medications.
Mhm.
Like, it starts from the education you receive from your physician about the medication and like why to take it, what to expect, like what to look out for. And then I think like making it easy for yourself. Like sometimes I talk to people who are taking their medications and they're like, yeah, I just set an alarm for like the middle of the day, and I'm like, you're just like making it hard on yourself. Like
Right.
I feel like just like do it when you're brushing your teeth, or like keep it in the same place. Set an alarm. I don't know, like I really make it as easy as possible for yourself.
That's wise.
Yeah.
I'm all about making things as easy as possible.
Seriously.
And so for me, I have one of those old school pill boxes. It's like I plan it out because especially on days like when my hands or wrists are swollen
Come
from
on.
arthritis, it's like
Right.
trying to get open those pill
Always
boxes
like that,
is
yeah.
not cool.
Mhm.
So if I can just flip up a little thing and pop it, it's like, oh, I can handle that.
Right.
It's our adult shot, Chris. We talked about how we had to learn how to drink like an adult rather than
That's right.
taking shots. I do my pills.
That's it. Just throwing them back. That's it.
Yeah,
I'm an excellent pill taker.
100%.
one of the big things is like fear. It's not even just side effects, like fear of
Mhm.
side effects. I know like I've been researching hydroxychloroquine.
Right.
Like the main feared side effect of that is retinal toxicity, which can occur like after years and years of taking it.
Right.
Making sure you go to your regular ophthalmology appointment and like trusting that they're looking at your eyes and like not seeing anything, you know, they'll like tell you.
Right.
Can alleviate. A lot of people struggle with medications because like of the anxiety of having side effects.
Mhm.
Making sure you go to your appointments and that people are like checking on what could, you know, potentially be like a toxicity, like
Mhm.
that alleviates my anxiety.
Right.
But so like staying consistent with like your appointments, I would say is a big one.
That makes a ton of sense. Makes sense. Yeah, I mean, because to be honest, you look at some of these side effects, just like on the paperwork that comes with the medicines. It's terrifying. Just or watching just like a commercial, and it's usually like the happiest scene playing out. Like they're like throwing a frisbee or having a cookout, and then you hear like all the side effects. Like this sounds awful. This sounds abysmal. Like you're trying to make it seem as pretty as
Yeah.
possible. It's terrible.
They're like kayaking and they're like, may cause sudden death.
It may cause sudden death, bleeding out your eyeballs, and just like, whoa, this doesn't sound pleasant. So I hear you.
But I've actually asked my eye doctor about, because I'm on Plaquenil, what's the game plan here? When it gets to a certain point, we'll just tell you need to stop taking the medication. As simple as that. I got that reassurance that they are looking for something. There's a risk there, but if they're staying on top of it,
Right.
it provides that sense of security.
Yeah. Don't be afraid to ask your doctor questions about your medication or to like tell them if you're not taking it. I think there's so much like guilt that comes with like feeling like you're being a bad patient.
Yes.
But
yes.
like you're just human and you're making decisions that like you think are, you know, are rational.
Mm-hmm.
If you're like worried about what they're going to think of you or if they're going to like treat you differently because you're like labeled as like non-compliant, like then like it's time to get a different doctor. Or like you might be surprised, like they might actually like be able to answer your questions and alleviate some of your fears about it.
That's real. I think people, to your point, Meredith, go into the there's a whole thing called, what's it called, white coat syndrome, where your blood pressure goes up when you're in the doctor's office. I think there's so much fear and anxiety and so much unknown surrounding each appointment that we have.
Yeah, just remember, you're the patient. You're paying.
That's true.
They're at your service.
The customer is not always right in this instance. I will say that the customer is not always right.
But expressing like your concerns or like just kind of any anxiety around it, then they can help work through it with you. I know this last infusion that I did, I talk to my rheumatologist. Like, I was honestly scared about how intense the medication was and the risk of infection and all the other stuff that comes with it. But my lupus was active, and it had been for several months. And he's like, okay, so we have to balance the activity and you going into a potential flare. And I've had organ complications. And so that's where it gets a little scarier. And so we had a conversation about it. I ultimately ended up doing it and do not regret it because I feel so much better. And regardless of whether I decided to working with him and talking through that with him, it was a joint decision.
It's healthy.
Well, I'm optimistic. First of all, the future of rheumatology, I think that like in our lifetime, I'm just optimistic that they're going to come up with like they're doing great research, and I think that there's going to be a lot of like improvements in treatments and, alleviating symptoms and that kind of thing. That makes me excited for the future of rheumatology. And then like in general, just like there are things that I don't like about the future of medicine that are becoming detached between the physician and patient, but in my school in particular, there's an emphasis on physician-patient relationship and cultivating that. So it's my generation that's going to fix that.
That's it. Well, we're excited for it. And I definitely think, I've said this before on the podcast, but I would never forget the words of my first rheumatologist who told me, Mr. Burton, this is the best time in human history to have lupus. So I think, to your point, the amount of research that's come out just in the last decade plus has just been, moving the progress forward light years. So excited too.
Chris and I've been in this journey a bit longer than you have. And to his point, the progress we've seen even in the last decade is phenomenal. With you doing your medical training now, I have high hopes for the next decade for sure.
Nope.
It was so wonderful talking to you today. I know you're crazy busy juggling a lot with medical school, but we so appreciate you coming on and telling your story and talking to us about your experiences.
Thank you so much for having me. It was just really great to talk to you guys, and it feels like cathartic.
Yes, that's what we want. That's what we want.
Yeah. Oh, I really loved this experience.
Oh, no, that makes us happy. That makes us really happy. And not only thank you to you, Meredith, but thank you to you all for watching and listening. And please be sure to rate us on Spotify, Apple, any and everywhere you listen to podcasts. Also, make sure that you're checking out the episode info. We put a lot of sources in the episode information, so make sure that you check that out and continue to just educate yourself and just find all the resources you need for this journey that we're all on. But until next time, everyone, please do take care.
Thanks, Meredith, and take your meds too.
There you go.
Thank you.
Peace.